Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
One of the paragons of cardiovascular health is the health of what we call that one cell lining, or noted as the endothelial lining. All 64,000 miles of our cardiovascular system has that lining. That's correct. Arteries and veins too. Now, there's a reason for that lining. That lining allows for the slick and quick motion of blood leaving the heart and moving through the body quick enough so that, by the way, it even returns faster velocity-wise than it did when it left the aorta. Most now agree, and most studies, that the endothelial lining is the underlying root cause, and since we do root cause medicine, of particularly coronary artery disease. And there's many reasons it begins to go bad. The endothelial lining requires to be kept healthy with nutrients and, of course, careful diet, exercise, etc. One of the things that I do all the time to measure that is there is a saliva test on a stick that in less than 20 seconds, you can measure the production of nitric oxide. The endothelial lining is pretty much responsible for that. And when it's low, we can recognize, at least initially, there may be some problem. Now understand, if you brush your tongue, because of the facultative anaerobes that lie within the crypts of the tongue, and also using perhaps mouthwash or scraping your tongue, you're going to remove that component of the microbiome in the mouth. Yes, the microbiome in the mouth is the second largest microbiome area outside of the gut. We talk about the gut enough, but we never really speak too much about the mouth. So if someone has been using that, or they're older, because as you age, the quantity goes down. So the difference by the age 70 to someone 25 is only 15% of a 70-year-old to a 25% to a 25-year-old in general. And that also begins to tell you there may be some compromisation of that endothelial lining. The sine qua non way of knowing is doing what's called an autonomic nervous evaluation. The ANS test particularly does 5 tests that are relevant and also can tell you how severe there is of endothelial dysfunction. These are the most common ways of knowing. Now, I group the combination of 2 tests in the following manner. I will look at initially the test of a stick in the mouth to tell me about endothelial dysfunction. I will get blood tests of cardiovascular nature that will often talk to this particular problem, especially like lipoprotein a, which substitutes for vitamin C in the endothelial lining, maintaining its integrity. I will look at the detoxification process through homocysteine. I will look at apolipoprotein B and apolipoprotein A for its consistency in that lining have a problem. I will look at plaque 2 test, PLAC2, to determine whether there's any potential for plaque to break off, and of course, very importantly, C-reactive protein I sensitive. With this and fibrinogen, I'm able to tell if there is inflammation within this cardiovascular structure. If there is, you can be assured that the endothelial lining has either been damaged, if it's chronic, or it is getting damaged. But those components are pretty much still putting the things on the table to make a piece of pottery, like the water and the spindle itself, so forth. It still doesn't make the disease. It needs to be determined in a kiln to make it a piece of pottery. In the case of the endothelial lining, the autonomic nervous system evaluation will give us a very complete picture. If both are positive, then you can very much consider that your patient is and has pretty much coronary artery disease, let alone other issues that may lend itself to more aggressive and problematic issues such as an MI or a CVA. So make sure that you are looking specifically at the endothelial lining with these tests, testing it at least orally to get a good idea, and then using treatment protocols that will respectively help to repair. It's not about just giving something to reduce one of the blood tests. It's about the root cause and trying to be able to repair the lining of the arteries and the veins so these patients don't suffer long-term cardiovascular deleterious effects. Thank you so much.